Hi friends, welcome to Interactive Medicine. In this video, we study the temporal bone and its part. Here we can see first the squamous part. It forms the front and upper part of temporal bone and is scale-like, thin and translucent. We can see here. Here is the squamous part of the temporal bone. It is the lateral side or external surface of temporal bone. And next we can study the mastoid part. The back part, it is the back part of temporal bone. It is rough, rough surface gives attachment to various muscles, and it has opening for the transmission of blood vessels. We can see here. Here is the mastoid part. And the petrous part, it is the pyramid shape. Is wedged in at the base of skull between sphenoid and occipital bones. Here is the petrous part. And the next one is the zygomatic process. It is long, arched process projecting from the lower part of squamous portion of temporal bone. It articulates with zygomatic bone. Here is the zygomatic process of temporal bone. It is a small portion of zygomatic process. Okay, next we can study the internal acoustic meatus, is also known as the internal auditory or internal acoustic canal. Is a canal within the petrous part of temporal bone of the skull between the posterior cranial fossa and the inner ear. The tube running from the outer ear to the middle ear is known as external acoustic meatus. From pinna to eardrum, the length is about 2.5 cm and the width is 0.7 cm. We can see here. Here is the external acoustic meatus. Next, we can study the groove for deep temporal artery. It is lie on the outer surface of squama. It is the branch of second part of maxillary artery and it supplies the temporalis muscle. Here we can see the groove for deep temporal artery. Next, we can just look into the anterior portion of the temporal bone. Here is the anterior portion. It lies in the inferior lateral portion of the skull, and behind that it is a posterior. Here is the inferior surface of the temporal bone. Here is the mandibular fossa, is the depression in the temporal bone that articulates with the mandible in the temporal bone. The mandibular fossa is bounded anteriorly by the articular tubercle and posteriorly by the tympanic portion of temporal bone, which separate it from external acoustic meatus. Next. Here we can see the mandible. Then here we can study the hiatus and groove for lesser petrosal nerve. The petrosal nerve reaches to the foramen ovale. This groove and hiatus lies in the laterally. And next we can study the hiatus and groove for greater petrosal nerve locates medially. The nerve is assigned to foramen lacerum. Above we can see the sinus runs in attached margin of tentorium cerebelli in a groove is known as the groove for superior petrosal sinus. It is in the top part of temporal bone formed by the sinus itself. The sinus receives some cerebellar veins, inferior cerebral vein and veins from the tympanic cavity. The inner surface of the mastoid process presents a deep curved groove, the sigmoid sulcus. It is a broad groove in the posterior cranial fossa. The sigmoid sinus moves in a downward manner through an S-shaped groove. This groove lies behind the middle of sigmoid, an area of bone behind ear. Here is the groove of sigmoid sulcus. Next we can study the trigeminal impression. Is a depression on the anterior surface of the petrous portion of temporal bone near the apex formed in relationship to the trigeminal ganglion. We can touch and sense the depression here. Here it locates. And next we can study the arcuate eminence. Is a prominence indicating the position of the superior semicircular canal. And in the base of the mastoid process, we can see the mastoid foramen is a hole in the posterior border of the temporal bone. We can see it here, mastoid foramen. It transmits a mastoid emissary vein to the sigmoid sinus and a small branch of occipital artery, the postmeningeal artery, to dura mater. I think this point is clear for you. Next, we can study the carotid canal. Its opening or inlet is present in the inferior surface of petrous part. Through the opening of carotid canal, the internal carotid artery and its plexus pass to cranial cavity. It can seen in the inferior surface of petrous, as we already mentioned. Here's the outlet of internal carotid artery. Next, we can study the canaliculus. There will be two canaliculus in the inferior surface of petrous, the tympanic canaliculus and mastoid canaliculus. Tympanic canaliculus is near to tympanic cavity, and the mastoid canaliculus is near to mastoid process. Tympanic canaliculus is a small opening on the inferior surface of the petrous portion of temporal bone, transmitting the tympanic branch of glossopharyngeal nerve and a small artery. Mastoid canaliculus is a small channel in the temporal bone, transmitting the auricular branch of vagus nerve. Here is the mastoid canaliculus. And just in front, we can see tympanic canaliculus. Next, we can study the inlet and the outlet of the facial canal. We can see now the inlet of the facial canal is the internal acoustic meatus. Through it, the facial nerve pass to the tympanic cavity, and the outlet is the stylomastoid foramen. We can see now the outlet of 7th cranial nerve through the stylomastoid foramen. It is on the inferior surface of petrous of temporal bone between the base of styloid and mastoid process. We can see here. Here is the stylomastoid foramen. Next, the final point is we can study now in the posterior medial surface of petrous. We can see a foramen just behind to internal acoustic meatus is known as the vestibular aqueduct. Is a bony canal running from the vestibule and opening on the posterior surface of petrous portion of the temporal bone, giving passage to the endolymphatic duct and a small vein we can see here, but it may be it is inconsistent. It may be present or absent. Okay friends, thank you, have a nice day. I think this video is helpful for you. Bye.